Our next speaker is Dr. Gakombe Kanyenje. I know he's not new to many of you. He's the chair of the Kenya Healthcare Federation, which is the health board of KEPSA. We asked Dr. Gakombe to just come and talk. So he doesn't have a presentation. We're like, no, Dr. You can just come, you talk and you tell us what you know about Kenya private sector experience supporting the Ministry of Health. And I know there have been very many lessons, especially coming from COVID-19. I know many of you, especially those online, you have very many questions. Some of you haven't posted the questions. We'll take them after the break when all our presenters have spoken, and we'll be able to answer all your questions. So please just post your questions. We are keeping tab on them. We'll answer them after the break and after this presentation. So Daktari, karibu sana. You're between us and the break.
When I was invited, I asked myself what I should come here and say. I'm not from the Ministry of Health, so I'm not a policymaker. I'm not an academician. I am long done with studying. I am from the School of Hard Knocks. I'm from industry. I'm a practitioner. And I'm not even in active medical practice. I am the guy who asked the doctors why they did not finish work on time and why things are the way they are and how they should be, because I run a hospital. And I thought perhaps the best thing I can do, because you are talking about policy and innovation, to try and link the two and to tell the many skeptics, because there are many skeptics in Africa about innovation and policy and government, that it is possible in the space that we have and the countries that we are in to innovate within the environment that there is. And that, if you look hard enough, there are certain aspects of enabling that exist. And increasingly, you don't have to look very hard in Kenya, that the opportunities that are provided for us to take advantage of and build institutions. I started Metropolitan Hospital way back in 1993. And at that time, people told me I was nuts to go and start a hospital in Eastern Nairobi, where there was nothing but criminals. And I was more likely to be shot dead than to succeed. 27 years later, we have an institution that is 160 beds, that has the best theaters in Eastern Central Africa. We will have a conversation. We'll have a conversation with KU and compare notes and call independent judges. But we have very, very good surgical theaters. We are doing level 5 and level 6 operations. And we believe we are the most digital hospital in this country. That one, KU cannot compete with us. And this came about because it was possible to innovate and get resources and start a business. The first question is the source of the money, because one of the key things with innovators, people who have ideas, inventions, is where do you find money from? I found 500 Kenyans and 1 Briton and a couple of Americans to fund the start of Metropolitan Hospital. They are still shareholders. I do not own it alone. So I know it is possible to sell a startup. And if you don't believe me, look at the amounts of money Kenyans have put in DESI, pyramid schemes, all sorts of places as they are looking for a return. So let's not say the money is not there. What we have is to present our investments in ways that are attractive. And today it's much better than when we started, because banks are willing to fund. Most banks now have a private, a healthcare division. Private equities in this country, there are people who are willing to invest. So there is more organized investment than there was that time. So it is possible. The other thing I want to say is that all innovations are born out of a challenge. And those who are trying to get into the private sector space, to partner with government, must find a public problem to solve. M-Pesa is as large as it is because there was an enabling environment. And secondly, because they were solving a problem for literally each and every single Kenyan who is in this country. So today they are a very large company because they solved a public problem, which was how to get money from A to B, from two people, to connect two people and pass money from one to the other without the need to physically travel or send a neighbor, or the other things that we are using before M-Pesa. So we have to take the policies presented by Mr. Macharia, the policies and the opportunities that exist in our country, and find within that a public problem to solve. I came here to learn. I was a guinea pig in the LIHO program because Strathmore figured out that healthcare workers, the managers in healthcare were mainly healthcare professionals who did not know which way to read a balance sheet. Even if you put it upside down, most of us would just have read because we couldn't tell whether it's upside up or upside down. And that's an opportunity and a space that Strathmore has continued to fill to date. We are digital because I had a problem. The problem was that the hospital was leaking. We are making losses. We are growing each year, but the losses were getting bigger. And the accountants told me two things. The first is you have no controls, and the second is that you are financially semi-literate. I wasn't quite illiterate. And so we started looking for software to buy. And the software we found was like the condom story. It was costing more than the entire value of the hospital. It was from the UK. And it became clear that we couldn't afford it because what we are being offered is akin to selling a car to buy a battery for it. So we began to build software. And we built a digital environment that is gone to the point where we now have a system in use in Tanzania, in Uganda, and we are looking for other places to take it. So the software became a different business that is part of the Metropolitan Group today. So for those in the innovation space, my message to them is first, get organized. Get organized to influence policy in an enlightened way, because government's job is to serve the public interest. So if you're only looking for a piece of the pie for yourself, you will not get traction. In order to align your private interests and get public support, you must align your private interest with public interest. That way, then those in government will find it in their interest to help you facilitate and assist them to solve their problem, because their problem is to serve the public. And many times we don't make progress because you're only looking at me and not considering that those who serve in government have a problem to solve too. And they have a constituency and a mandate and a customer, 50 million in the case of Kenya. So we in the private sector have to align with the public interest and make sure that we are serving in ways that the government feels we are helping to solve a problem. Then in dealings with government, a lot of people are skeptical in Africa. I'll speak about Kenya because I don't make broad statements about places I don't know. I know my country reasonably well. And for historical reasons, many of us tend to treat government as an occupying power. Because of our colonial past, we see Serikali as an outsider, as a stranger, as a foreigner, as an invader, as something other than ourselves. And we couldn't be more wrong, because Macharia must be from somewhere around the mountain, Most likely, the name Macharia comes from a fairly small region in central Kenya. So I can almost put a pin, and Wangari from the Presidential Delivery Unit is Kenyan. And it's unfortunate that two people finish their medical school. One joins government, like some of my classmates did. The other one goes to do what I do. And then you begin to treat those people like an occupying power, because ultimately, government is an organization which is served by fellow Kenyans. And we must move away from that historical context and begin to see the government as us. I keep asking my staff, why are you telling me about government? Who in government? Yesterday we had a problem because we are tired of filling manual forms. We consider ourselves a very innovative organization. Mr. Macharia have said we will not fill forms for the government of Kenya unless you are willing to pay us, because we can give you everything you want in digital form. So I asked my staff, who insists that you fill manual documents? And they told me it's the government. And I asked them, who in the government? Is it the president? Is it the CS? Is it Dr. Amoth? Go down the chain until you tell me this particular person who insists that you fill manual forms. And no one could answer my question. So we are now on a mission to get rid of manual forms, not just for Metropolitan, but for every other private sector player who is able to submit their data in digital form. And Dr. Jenga did say that one of our problems is having many databases that do not speak to each other. So KHF is working very hard to get these databases to talk to each other. So we from the private sector must learn to trust government. We from the private sector must organize ourselves by joining associations, by joining federations, so that we can engage with government in a more organized manner. So that they don't have people walking in and out and saying we are the representative. And that's why KHF came about, to try and organize the voice of the private sector so that we can engage with government in a more meaningful manner. And as I wind up, I want to say that in the time I have to serve, we are focusing on exactly the same thing. Because of alignment, we are focusing on human resources for health, because we have a challenge and we have an opportunity. There is a global shortage of healthcare workers. It's just that we can't send ours because we don't have enough. And there is nothing new we'll be doing. I grew up in a coffee growing zone, and we are growing coffee for export. All we need is to change from growing coffee for export to training Kenyans to go and serve elsewhere, not as menu workers, but as professionals. We are focusing on digital health. We are very, very focused on healthcare financing, because at the end of the day, we must have the resources to provide healthcare. We are focused on supply chain, and we have solutions that would avoid the kind of fate that has befallen KEMSA, because you'd have a much more transparent system for keeping track of what was the price of a glove when COVID was at its peak, because the prices kept changing. And in conclusion, I want to say this. I want to say that this is a good time for the health sector to get organized, to innovate, and work together. Why? Because in Kenya, and I served in Mzee Kibaki's Economic Council, healthcare in the NESC meetings was not even on the agenda when I first joined NESC. Today, it's part of Agenda 4. We have moved from not being there to being a footnote and an AOB to part of being the 4 key things Kenya must deal with. So if we don't use this opportunity now, it's not coming maybe in our lifetimes. 2, COVID has proven a number of things. The first one is we can operate digitally. I spent 10 years trying to tell insurance companies that forms were not good. It took COVID 3 weeks to convince many of us. And Dr. Mothe is in the house, so he's, he was ready when the industry began to push from papers to digital format, so we can work digitally. So digital health has an opportunity now. COVID showed that no one in the world has a curative system which is large enough to cope, which means that when you talk about preventive health, people can understand, because we saw footage of people dying for lack of oxygen, Americans' hospitals being overwhelmed, hospitals in the UK getting overwhelmed, India running out of oxygen. You now don't need to tell people that the cheapest healthcare is the one you get at home, because we have seen that even the US cannot cope. COVID showed the importance of the health sector, that we can't be a footnote even if somebody tries to make us one. And COVID showed that you have to have an all of country response when you have health issues. It cannot be government, it cannot be NGOs, it cannot be private for profit, it cannot be faith-based. It has to be all of us, the whole of government, and the whole of everyone else, including people who make jeans, who had to start making masks, and alcohol manufacturers who had to start making sanitizers. So we know that in order to respond to our healthcare challenges, we cannot leave it to the Ministry of Health. It has to be the whole government, and we cannot leave it to private healthcare. It has to be the whole of the private sector, and all citizens must come on board, because the biggest interventions are at community level. So this is our moment, this is our season, this is our time. It is for us to put it to full use, so that by the time people begin to forget, we will have made so much progress that we can't possibly be taken back. And I'll finish by saying this. Many advances have been born during periods of great adversity. Many of the healthcare innovations that we are enjoying today were unfortunately born during the Second World War, when the whole of the world, in curative health, when the whole of the world was at war and we had to treat injured soldiers, there were many things that needed to be done there. Some of the research was unethical, but it took that very, very distressing period to raise many industries, healthcare, aviation, to the next level. Let us not miss the opportunity that COVID brought to our country and our shores. Thank you.
Thank you very much, Daktari. Let's give Daktari a round of applause, another one. Thank you very much, Daktari. I think you have circled back to what Dr. Kibia said. You don't waste a crisis. So I think the onus is on us here, and those of us who are online in the health space and other spaces that feed into the health sector, to make sure that we take advantage of this and take us to the next level. And I think that's why this health summit is here. It's very timely for us to bring all these thoughts together, and from here get something to move forward with. And I think, I don't know if it was deliberate, Dr. Ofula, that it's at the end of the year, so that we start the new year on a high note, when we have a lot to do and a lot to implement. So thank you very much to all our presenters, Dr. Gakombe, the chair of the Kenya Healthcare Federation, Stephen Macharia from the Ministry of Health, and Dr. Saruk from the Phillips Foundation, who joined us online. I'd like to release us for a 15-minute break. Then we come back top of the hour